I gotta say it. Guys, we are at war with two enemies. The first enemy is the one of viruses, right? Everybody's talking about it. You've seen it. It's everywhere. The second enemy, no one's talking about, but you've seen them too. They were in the batch of emails you got about COVID-19. We're taking every precaution to help you, our valued customer. The same companies that are in business to hijack our taste buds, destroy our immune systems, and make us susceptible to viruses and disease in the first place. So I'm gonna say it again. We are at war, and the battlefield is your body. Every soldier knows when you go to war, you wear a bulletproof vest. You wear a helmet. You have your artillery. Well, in this war, your armed forces is your immune system. And your artillery will be the protective foods you can eat that will shield you against the invaders, i.e., viruses. You have to be the general of your own body. You were drafted into this position at birth. Now I gotta tell you guys something that you probably don't want to hear. This virus, it's not gonna go away in a couple of months. Scientists will have to find a reliable treatment for it. It might be the hydrochloroquine with zinc. It might be something else. It could take a while to determine what's safe and effective. According to Harvard epidemiologist Mark Lipstitch, 40 to 70% of people will be infected. And yes, for most people, they will only have mild symptoms. You are likely to come into contact with this. So how do we put ourselves in the best position possible? I'm gonna tell you. Now listen, this is not medical advice. I am not an immunologist. I am not an infectious disease expert, but I have dug through the scientific studies, the academic peer-reviewed journals, and I will provide these studies for every claim that I make. I have taken my nutritional research that I've done over the past 5 years. I have combined that with recent data, and voila. These are the food, supplements, and actions that I will be taking during these times. Now, will this make me invincible? I'm already invincible, baby. No, kidding. This will not make me invincible. But evidence suggests that it will increase my chances of survival with very little risk. Please do your own research and make sure that you A, don't have any allergies or autoimmune complications, and B, these don't conflict with any other medications that you may be taking. Talk to a doctor and make the best decision for you and your health. Now you may be asking yourself, why are you even doing this? It's simple. I refuse to accept that so many people have to lose their lives and suffer because they don't have the proper information. See, I believe that it is the obligation of content creators like me to serve and protect our communities and not just take advantage of them like I see so many content creators do. Now, here are the 10 foods, supplements, and actions that you can take that will help you survive COVID-19. Number 1, go fruit yourself. No, really, troops, our first line of defense is fruits and vegetables. They are like the moat that keeps the enemy out in the first place. In one study, elderly people were given 5 servings of fruits and vegetables to eat for 16 weeks. Then they were given pneumonia bacteria. The people who ate the fruit had almost double the strength of an immune response than those that didn't. Now you may ask, what types of fruits are the best? Whichever ones you eat. Now go for a colorful selection. All right, if you have the money, go for organic and make sure you wash the fruit off thoroughly before eating it. Now, when it comes to the best types of fruit, studies show that the kiwi leads the pack. The kiwi is packed with more vitamin C than an orange. Research shows that kiwis reduce severity and duration of upper respiratory tract infections. Another study of young children showed that the kiwi gave them almost a 50% reduction of having a cold or flu. You add that to the fact that 2 kiwis before bed will improve your sleep quality and sleep disturbances. The thing about the kiwis is you can actually eat The skin, a lot of people don't eat the... Make sure you wash it thoroughly, though. Amazing. Another leader in the fruit category is wild berries. The polyphenols in the berries, which gives them that vibrant color, creates a significant antiviral effect. The darker, the redder, the more color that berry has, the more polyphenols and the better for you. Another reason to eat fruits, guys, is this. This is very important. Listen to this. A recent study by researchers from Wenzhou Medical University, led by Dr. Don Chin, revealed that almost all COVID-19 patients exhibited hypokalemia and that supplementation with potassium ions was one of the many factors that assisted in their recovery. Eat your fruits, guys. Bananas, coconut water, avocado. These high potassium rich foods will keep you covered. Number 3, broccoli sprouts. In a recent study, a daily shake of broccoli sprouts over days seemed to protect people infected with the influenza virus for longer than a comparable shake of alfalfa sprouts. The reason for such a powerful protective effect is because of the immune-enhancing substance called sulforaphane. Broccoli sprouts contain 20 times more sulforaphane than regular broccoli. Other studies have shown that broccoli sprouts alleviate depression in mice like Prozac. They slow tumors. Broccoli sprouts, when injected for 2 months, can protect against stomach ulcers, stomach bugs, and stomach cancer. And again, they reduce markers of viral infections in the body. These are my sprouts that I keep in the freezer. Freezing them actually doubles the amount of sulforaphane in them. Garlic. Yes, it can keep away vampires and also viral infections. Garlic is a natural antibiotic. It kills viruses directly and strengthens immunity based on multiple studies. Either pop a raw clove or crush it in order to activate the most benefits. This study showed that aged garlic extract, or AGE supplementation, may enhance immune cell function and may be partly responsible for the reduced severity of colds and flu reported. Now, me personally, I'm eating about 2 cloves a day. Not everybody can just eat the raw garlic because it's very potent. So you can also chop it up and just put it inside of food. But me, I don't try this at home if you can't handle it. And then I just wash it down with some green tea. Good stuff. Number 5, ginger. Now, ginger root has been used for years throughout Eastern medicine to treat colds and the flu. According to this study, fresh ginger is effective against human respiratory syncytial virus induced plaque formation by blocking viral attachment, meaning that the virus couldn't attach to the cells. Ginger, like garlic, is an old-time tested remedy for a reason. Why would you not include it into your diet? Now, me personally, I do the root, I boil it and put it in tea, but I also try the ginger juice, which is really, really good. Just a ginger shot and you're good to go. Number 6, green tea. Now, guys, I really can't say enough good things about green tea, but I want to say this. This is a recent study I found fascinating. So this study showed that black or green tea seems to stop viral replication of coronavirus in the gut. Wow. I think you guys need to consider adding green tea to your diet. A study done in the Journal of Nutrition shows that green tea consumption is associated with lower rates of influenza. People who drink it come down with the flu 3 times less. Gargling with green tea is also huge. I've been gargling with green tea about twice daily, and here's why. A recent German study published a not yet peer-reviewed paper providing evidence that SARS coronavirus 2 infects and replicates in the throat. I'm gargling at least twice daily. Here's more on green tea. A 2006 study in a Journal of American Medical Association followed 40,000 adults. Green tea is associated with reduced mortality due to all causes, meaning you have a lower chance of dying if you drink green tea. A 2017 Swiss study found that green tea fights and reduces anxiety and lowers the risk of Alzheimer's. However, guys, if you take blood thinning medication, I would suggest you not drink green tea or talk to a medical expert, because green tea can actually interfere with this medication. Number 7, Manuka honey. Winnie the Pooh would have loved this stuff. Now, any raw honey is great, except for the fake stuff. Don't get the fake stuff, guys. But Manuka honey might be the best of all. Manuka honey comes from the bees of New Zealand. This particular study showed that Manuka honey has potent inhibitory activity against the influenza virus, demonstrating a potential medicinal value. Number 8, turmeric curcumin. Turmeric is an ancient Ayurvedic spice known for its anti-inflammatory properties. Recent studies have shown its antiviral protective properties. This study shows curcumin inhibits viral infection and has promising potential for use as an anti-influenza drug. You need black pepper to activate the most of turmeric's property. Black pepper with curcumin enhances curcumin absorption by 2,000%. So coronavirus can induce what's called a cytokine storm, which basically is your body fighting against itself. But get this, curcumin has shown promise in preventing the cytokine storm and is a potential therapy for patients with Ebola and other viral infections. Similar to green tea though, guys, if you do take blood thinners, it might interfere with that. So talk to a doctor before you start taking turmeric. Number 9, nutritional yeast and brewer's yeast. It is a fiber called beta-glucans inside of the nutritional yeast that has shown amazing benefit. One study showed that people who ate a spoonful a day of nutritional yeast, it reduced incidence of a common cold by 25%, and people have fewer cold-related difficulty. Half a spoonful also had a big effect. You also get the added benefit of helping with stress levels, as nutritional yeast boosts your mood as well, which is extremely helpful during these days and times. Caution, yeast is high in purines, so those with gout, kidney stones, or a new organ transplant might not want to take nutritional yeast. Number 10, beetroot. Drinking beetroot raises the nitric oxide levels in your body. And look at this study. Apparently, there is some evidence to suggest that nitric oxide inhibits the replication cycle of severe acute respiratory syndrome, coronavirus. Other studies show that during periods of psychological stress, beetroot juice can protect against cold symptoms. Preliminary evidence suggests particular benefits in asthma, which could translate into reduced asthma exacerbations due to respiratory infections. Gotta tell you this though, guys, do not freak out when it turns your pee red. Now, before I get into supplements, I want to tell you guys about a rocket launcher for your immune system. We talk about artillery. This is the biggest, most powerful weapon that you have, and you already have it. You don't need to buy it. You don't need to get it. You know what it is? Sleep. Did you know that LeBron James sleeps 12 hours every night because he knows just how important sleep is for his body? You need to be getting 7 to 9 hours of sleep every night. I'm talking quality sleep. Your body needs time to recharge and regenerate. If you don't give it that time, you're destroying your immune system, raising cortisol in the body, and every food, supplement, or exercise routine that you're doing, it won't matter. Get your sleep. Now to your artillery of supplements. I think of supplements as grenades, small things that can have a tremendous impact in your health. Number 1, oregano oil. Oregano oil is well known as an anti-parasitic and a potent protector of your immune system. It kicks a cold fast, and in my personal experience, it cuts my sick recovery time in half. This study showed that oregano oil is effective in inactivating murine norovirus within 1 hour of exposure by acting directly on the viral capsid and subsequently the RNA. This study showed that oregano oil inhibited the growth of E. coli. Now, when you go for oregano oil, make sure it's wild oregano oil. 1 dropper full per day should be good for protection, and do not go more than 10 days in a row taking oregano oil. Number 2, zinc. Zinc is a well-known, well-studied, powerful illness preventer. According to Lise Alschuler, MD, professor of clinical medicine at the University of Arizona College of Medicine, assistant director, she says coronavirus appears to be susceptible to the viral inhibitory actions of zinc. Zinc may prevent coronavirus entry into cells and appear to reduce coronavirus virulence. Typical daily dosing of zinc is 15 to 30 milligrams daily, with lozenges potentially providing direct protective effects in the upper respiratory tract. You should take zinc before meals or 2 hours after meals. If we have a choice, we want to get vitamins and minerals from food. Oysters are a great source of zinc. Just a few of them will cover your daily zinc and copper needs. Copper is necessary to take with zinc, as most people will develop deficiencies when they overconsume zinc. Number 3, vitamin D3. Usually we get enough vitamin D from the sun, but so many of us these days are deficient in vitamin D, so we have to supplement. Vitamin D is actually more of a hormone than a vitamin, and it is responsible for more than a few hundred functions in the human body. A meta-analysis of 25 randomized controlled trials conducted in 14 countries found that vitamin D supplementation cut the risk of infection with respiratory illness by 50% in people that were vitamin D deficient and 10% in people with normal vitamin D levels. Since most of us are vitamin D deficient, this can have a huge impact on our protection against COVID-19. This study showed that vitamin D supplementation was safe and it protected against acute respiratory tract infection overall. According to experts, vitamin K intake is essential if you consume large doses of vitamin D3. Vitamin K will prevent vitamin D from promoting calcium entry into soft tissues and instead divert it to the bone. Vitamin K also helps in vitamin D3 absorption. Also, make sure you take vitamin D3 with a high fatty food like avocado, also in order to ensure proper absorption. 4,000 IUs of vitamin D is considered safe. Number 4, astragalus. Astragalus is an ancient Chinese herb that is known to prevent illness. Cancer patients use astragalus and it has very few side effects. In this study, the results proved that astragalus injection showed obvious anti-influenza virus activity. It can improve the survival rate of certain cells which were infected with the influenza virus, while it improved the blocking effect of influenza virus on cell cycle after injection. Number 5, elderberry. According to experts, elderberry sambucus extracts may help prevent early-stage coronavirus infections, as it inhibits replication and viral attachment of human coronavirus NL63, which is different from COVID-19, but a member of the coronavirus family. In this study, 60 patients aged 18 to 54 suffering from influenza-like symptoms for 48 hours or less were enrolled in this randomized double-blind placebo-controlled study during the influenza season were given elderberry. Symptoms were relieved on average 4 days earlier compared with placebo. Elderberry extract seems to offer an efficient, safe, and cost-effective treatment for influenza. An evidence-based systematic review of elderberry conducted by the Natural Standard Research Collaboration concluded that there is level B evidence to support the use of elderberry for influenza, which may or may not be applicable to COVID-19 prevention. Number 6, cortisone. Corticin is an amazing flavonoid found in fruits and vegetables. It moves zinc into the cells, which is very important these days. This study showed corticin reduces susceptibility to influenza infection following stressful exercise. Make sure you take EMIQ or biocorticin though, because corticin is poorly absorbed in the body by itself. Number 7, NAC. NAC is a very powerful supplement. It's used in many hospitals around the world, and it helps to promote healthy lung tissue. It shows promise in people with asthma. Researchers have found that NAC could also prevent the growth of cancer cells by depriving them of proteins that are important for their survival. In this study, only 25% of virus-infected subjects under NAC treatment developed a symptomatic form versus almost 80% in the placebo group. Administration of N-acetylcysteine during winter appears to provide a significant attenuation of influenza and influenza-like episodes, especially in the elderly high-risk individuals. N-acetylcysteine did not prevent the H1N1 virus influenza infection, but significantly reduced the incidence of clinical apparent disease. It also protects against swine flu, and results suggest that antioxidants like NAC represent a potential additional treatment option that could be considered in the case of an influenza A virus pandemic. Number 8, vitamin C. This is the most well-known and also controversial vitamin on the list. Vitamin C is a vitamin that we do not make ourselves in our bodies. We must get it through supplement or food. Here's one study on vitamin C that seemed to be effective for a very small sample of patients. It comes from China. High-dose intravenous vitamin C treated on 50 moderate to severe COVID-19 patients. The doses were 2 grams and 10 grams per day. The sample size obviously was very small, so we don't really have a lot of data to say that vitamin C is an effective treatment. Now, it is not recommended to take mega doses of vitamin C. However, 2 to 5 grams spread throughout the day of vitamin C should be okay, even if you pee most of it out. I would say try to get as much vitamin C as you can from foods. Red bell peppers are high in vitamin C, kiwis, broccoli, also a good vitamin C source, and the rest of your vitamin C supplemented. Go for the vitamin C powder or the liposomal vitamin C, which is the best absorbed form of vitamin C. I'm using Ester C, which is the less acidic version of vitamin C and also easier on your stomach. Make sure you drink the vitamin C throughout the day, because if you drink too much too fast, you can cause stomach pain and diarrhea. Number 9, B12. Research shows that over 40% of people in the US are deficient in B12. Adults over 50 are at the most risk, which also happens to be the demographic that COVID-19 affects the most. Like vitamin C, B12 cannot be made in the body, so it is important to get it through food or supplement. B12 plays an important role in white blood cell production, and white blood cells are so essential to proper immune system functioning. Number 10, medicinal mushrooms. Mushrooms have been used for various health conditions for many years all over the world. A medicinal mushroom formula called AHCC is really impressing me lately. I have yet to take it, but it is used in hospitals worldwide, and I believe that it could really help a lot of the elderly people today. Studies show it enhances the immune system and interferes with the viral replication and has a broad range of effects on the immune system, including NK killer cells and T cells. This abstract suggests that although it has not been specifically evaluated with respect to SARS-CoV-2 disease, its action in promoting a protective response to a wide range of viral infections and the current absence of effective vaccines could support its use in the prevention of diseases provoked by human pathogenic coronavirus, including COVID-19. There was also a medicinal mushroom formula from Paul Stamets called Host Defense that I also want to mention, as it could have tremendous benefit for many people. It is a blend from reishi, which is called the mushroom of immortality, chaga, shiitake, turkey tail, and 17 other immune supportive mushrooms. This formula was recently studied and has been shown to have a lot of immune benefit. Now guys, these are uncertain times. This regimen may seem like a lot, but it literally takes 5 to 10 minutes of your day to eat these foods and take these supplements. You don't have to take them all, and you don't have to take them daily. Do the best you can. Don't stress out about it. There are other foods like sauerkraut, like spirulina, like giloy that also might have protective benefits to your immune system. However, you have to create an overall healthy and balanced environment in your body over a period of time so that you can best protect yourself. If you combine these recommendations with the big 5, then you will be in great shape. What are the big 5? The big 5 are: number 1, a Mediterranean or G-bomb diet. What are G-bombs? G stands for dark leafy greens, beans, onions, mushrooms, berries, and seeds. If you eat these every day, you will be in good shape. This diet is so good because it's also high in fiber. Fiber intake is known to boost the immune system. Studies of centenarians around the world have shown basically one commonality: high fiber diets. You eat more fiber, you live longer. Number 2, plenty of spring water. Your body is 70 or 80% water. Your cells are water-based. You have to put clean, pure spring water into your body for it to run effectively. Number 3, moderate exercise, not intense. Overtraining brings your immune system down. Stress will cause your body to release a harmful level of pro-inflammatory cytokines. Make sure you have time to meditate and be still and practice gratitude, because gratitude is linked to a more powerful, stronger immune system. And number 5, sleep. Sleep is more important than your exercise and diet program combined. If you're not sleeping right, throw everything I just said away. Guys, if there was ever a good time to quit smoking and drinking, it's now. Smoking increases your risk of developing COVID-19, and so does drinking. Also, cut down your sugar intake. 1 teaspoon of sugar suppresses your immune system by 50%. 2 teaspoons by 84%. Guys, if you do these things, I'm not saying you will be invincible, but you will be in the best position possible to handle what comes your way. And most importantly, guys, stay home and stay smart. The point is not to get sick in the first place. So don't take any chances, don't risk it. Practice physically distancing, wear your gloves with everything you touch outside of your house, wear your mask in public, wash your hands for at least 20 seconds, and do not touch your face. Guys, please share this video with everyone you feel could benefit from it. I'm wishing you all the very, very best. Peace.